So we're going to talk today about hamstring tendinopathy, or pain that's typically associated with the base of your hip, right at the bottom of where your butt kind of meets your thigh. A lot of times people will have pain in this area, especially with prolonged sitting. So anything that puts pressure on that spot tends to be something that aggravates it. I see a lot of patients with chronic pain in this area. So we're going to talk about what that pain is, and then we'll get into some treatment options as we go through the rest of the program. So basically with a tendon, is where the muscle attaches to the bone, and over time, if that muscle is weak or not able to do what you're asking it to do, that tendon has this pressure pulling at it, almost like the muscle wants to rip away from the bone, which can happen but is rare. But as the muscle can't do what you're asking it to do and it pulls at that tendon, it irritates it and inflames it. And that's typically what we associate with tendonitis. Now, people can end up with a chronically weak tendon where if you never get the strength back in that muscle or the durability back in that tendon, it starts to deteriorate and weaken. So we're going to go through a program that talks first about lightly mobilizing the tendon without overstretching it, some things that dig into the muscle or points around that tendon to try and stimulate some change in the tissue, and then gradually we're going to start loading it more and more. A couple principles I want you to keep in mind. One is that we don't want to overstretch it. When you take a muscle to its stretched position, that's usually its weakest point. So if you take it there when it's already weak and sore, you're typically going to look at making it more weak and more sore. And usually it's people's instinct to stretch something. So if stretching was going to fix it, most of the time you would have fixed it yourself. So we're going to talk about doing some light mobility through the range, and then gradually doing some isometrics, which engage the muscle short of pain, and then progressing into gradually harder activities. The key is that you shouldn't feel a lot of pain in that spot that isn't relieved by a little bit of light stretching, or that should go away right when you're finished.